Yeah, I know, I thought he'd be killing us.
Okay, Ken, you want to start?
So we're gonna start.
Yep. Hi, I'm Anne Marie, here with another installment of I Signed Up for the Show Team. What's next? My topic today is equine veterinary dentistry. I am here with Dr. Matt Schaefer from Green Bay Equine, my horse Swede, and
Gina.
Gina. They are going to look at Swede's teeth. They are going to use a camera to look at his teeth, and then they're going to either float or do whatever whatever the assessment turns out to be. So, Dr. Matt, how did you get into equine dentistry specifically?
Oh, because there was a need for it in the area and nobody was really doing it. And we're talking 28 years ago.
28 years. So there are veterinarians that can do the teeth. So that would be kind of like the general practitioner, the family practitioner.
Yeah, and they all can do what I'm doing. I am not board certified in veterinary dentistry or anything. I just pursued the knowledge.
This is your niche.
I like to do it. I do other things as well, but I like doing this.
This as well. So, okay.
Yeah.
I'm going to let you start and get out of your way here.
So the first thing we want to do is an equine oral exam is look at the outside appearance of the horse. Do we see any muscle wasting or any lumps or bumps up by the cheeks, under the jaw? Look for facial symmetry or asymmetry, like maybe one of the muscles is working harder than the other. Move the jaw a little bit, kind of feel the TMJ. If there's something clicking in there, if there's any pain, the jaw actually hinges way back in here.
Way that far?
Way, so it's like a big hinge, yeah.
Oh, okay.
And after that, I like to smell the nostrils, because a lot of times you can smell a bad tooth before you even find it.
Right.
And so that passes, and we look at some of the soft tissue. Do we have any soft tissue problems going on here? Cuts, slips, and bumps, anything draining from the mucous membranes above the incisors. Kind of look at the incisors, see what's going on there. And that all looks pretty good. Looks like he's had he looks like he probably had an eye ulcer at one time because he's got a big old
Look on the other one too.
spot, yeah.
That one's a new one.
Sure. So what we're going to do is we're going to take a halter off now after that.
Okay.
And then we're going to wash them out. A lot of people think that when you're doing shots and coggins, when the horse is bopping its head around, that this is a dental check.
Right. Right.
That, my friend, is not a dental check. Because all you can do is see the first couple of teeth and you do not know what's going on in there.
In the back.
In order to do a complete dental check, we start like I did, but you need a full mouth speculum. Pull his mouth over. Sedation, which you can see he's clearly sedated. And he doesn't try to kill you when you're doing it. And you slide that on there like that. Open his mouth up like that. Wash off all the teeth and you should be able to touch, feel every single tooth in his head and look at it. Just like our dentist.
Okay.
Our dentist has to look at every one of the teeth to make sure that the crown health and the periodontal or attachment health of the horse is in good shape. Because any Tom, Dick, and Harry can float a horse's teeth.
Okay.
Maybe not, but
With the right
what
gloves.
you're paying me for, as opposed to lay dentists, which is illegal in Wisconsin, they're not supposed to be practicing veterinary medicine, is that I'm doing an examination of the oral structures of the horse's mouth and other things as well. So I'm going to make sure that the crowns are healthy, the actual teeth are healthy before I even float them.
Right.
Because you can float a bad tooth till you're blue in the face and it's not going to do it. It's still a problem. It could be cracked, it could have a pulp-borne infection, it could have a bad infundibular caries. It could have diastema periodontal disease, periodontal pockets, to name a few things that can go on there.
Sure.
Yeah. Now, do they all have that? No. But you got to be able to catch it if you're doing your job.
Right, and you have to know what you're looking for in case you do.
So honestly, you know, you're paying me to do this exam. Again, the floating with the equipment now is so easy.
Okay.
So we want to make sure that we don't have any problems down the road that are going to cause more problems than a couple of sharp points. Points are easy to fix. Now we're probably going to want to come up with a camera, and we're going to do a occlusal view of the horse's molars here, or just kind of look at the occlusal surfaces. And you can kind of see when you look at the teeth, he's an older horse, so his teeth are kind of worn down through attrition and through wear. They kind of get down to the gum line, and you kind of see that there is a fair amount of wear on those teeth, but yet he has all his teeth and they're not in too bad a shape. Yeah, he's leaning back on us there. Okay.
Oh, wow.
And you can kind of see the occlusal surface. It's very quite uneven. He does have some diastema going right in there.
The diastema is the gap
Space between the teeth. Yeah.
Okay.
He has old infundibular caries, but at his age, there's quite a bit of wear in those teeth, so that's not really a big problem. However, I do want to flush out those diastema real quick, and then we'll go in with the endoscopic camera,
Okay.
and we'll actually look at the surfaces. So next thing I'll do is I'm going to flush out his diastema. I think we're going to have to get a little move. Once we do this, we're going to have to move the horse a little closer this way because we're getting miles away from the camera right now.
Okay.
All right, so this is under high pressure, so I can flush that out in those spaces. Anything that he has there.
Yeah, he grabbed a bite just as he was coming out.
That's all right.
Oops.
They tend to want to do that. Halflingers can do. They want to sit down on it. Yeah. And then you just got to be patient.
Okay.
Patience is a virtue.
Move with him. No. Good boy, the bucket. Oh, sorry. Good boy.
And we can back him in a stall if we have to. If he really tries to sit down all the time. Or we can give him some Pervigen, which will make him come forward. It's another sedative drug. Again, I try to save you a little money by not going crazy on this stuff.
Right. You're okay, sweetie. Whoops.
So hopefully you have the ability to edit that video a little bit, because some of this is going to be kind of...
I don't know how to edit, so I just kind of go with the flow and... Oops, I'm sorry.
And there may be other equine dentists or somebody or veterinarians that watch this that may do things a little differently. And
Sure.
I guess that's okay too. So, you know, when you put stuff on Facebook, you're up to being savaged by the general public. So generally I don't agree to that, but we could probably try it. We'll see how it goes here.
Okay.
But people can be awful damn critical, so.
You sure can. You know, anything you do,
You do it wrong.
the wrong saddle, the wrong...
Right, so we're just trying to get that cleaned out really good there in those diastema, so we can get that. Okay, thank you. Now what we're gonna do is we're gonna bring Mr.
Bring him back up here.
all the way back up.
Will he leave with the speculum?
Yes.
Do I need?
Yeah, we're gonna have to grab that stand, so you're gonna pull him up. If you wanna grab that and pull that.
Sure will.
I'm gonna go ahead and grab this.
I came dressed for the occasion.
Come on. Keep going, we're going way up here. Come on, buddy.
Oh, my goodness sakes.
Perfect.
Yes. Better lighting.
Perfect.
There you go, sweetie. No, you can't drink that, honey. No. You don't want to drink that.
Just get his head, Gina.
There you go. Got him? Got him? All right. Look how dopey he looks.
Alright, we got a little pick for that. Let's see what we can measure the depth of his diastema. I don't think it's really deep ones, because generally halflingers have really good teeth.
Good teeth?
Good.
Oh,
yeah.
good.
They're just a bit hardy.
So that's the same kind of tool that they use at the dentist for me to checking
Yeah,
out teeth.
absolutely, yeah, see the depth of the diastema.
Good boy.
Alright. What's a little long? This one.
He had taken lessons, so his aunt had horses, and like out of the 3 kids, he was more drawn to horses. And I didn't even know that when we started like dating. And then I decided to throw him on one of my really safe horses, and I was like, "Have you ridden that one?" And he's like, "Well, like years ago when I was little, like."
They're so heavy, aren't they?
They are.
So he like just
How much do you think that weighs?
and then he tried out
150 pounds.
so he actually gave up.
Yeah, it's just kind of, that one's the biggest one right there. Little space. There we go. Got her cleaned up.
Good job.
Good boy,
Good job.
He's such a good boy. Grown.
Yeah, that's about 15 millimeter. You can kind of smell those diastems. They have kind of a stale, dirty sock smell to them. Really? That feet's been jammed up in there for quite a while. Cool. Now, let's get on the camera.
All right.
And we'll look around in there. So, we're gonna take this stand away. I'm gonna move him closer again. I think I'm gonna give him a CC over too, just because.
Plant is.
Yeah, it's gonna be really hard to do anything. So just hold him. Torbagesia tends to make them, instead of backing up, they come forward. In this case, which would be nice.
Right, right.
Yeah.
What is it called?
Torbagesia, it's to be torquing.
Torbagesia. That almost sounds like.
Yeah. It's a controlled substance that we have to log every single CC and everything
Yep.
that we do.
Yep.
Which is right there.
Bernard's key in the hole.
And we're gonna do that right away, so we never forget and get in trouble.
And then they have somebody say, "Here, ride my horse." Yeah, and she.
Does that ever happen to you?
Oh, right. Somebody that's like, don't touch my horse. Right. Be like, and then don't put stuff in front of my stall. Yeah. My husband's horse turned out to be.
There you go, bud.
There you go.
Owner of Brooks.
That'll make you happy, camper.
Yeah.
All right.
He may like twitch a little bit. Torbagesia sometimes makes him twitch. Don't be alarmed. That's
Okay.
not a. He's not gonna have a seizure. He's just got a little Torbagesia twitch going.
What is that when you take meds and you get the twitch, the tick?
Yeah.
Good boy.
Hopefully it'll stop.
Yeah.
And let's go over his head that way a little bit. Perfect. Thank you.
Yeah. Wow.
So that spot that I just cleaned out. There's that tooth. And there is a spot that I cleaned out.
Oh, right in between?
Yeah, right in between the teeth. So
Okay.
it's not real deep. About 15 millimeters. That's not a big deal. And there he goes.
And there he goes.
And it's so happy.
You're supposed to go forward, silly.
Well,
He didn't get the memo.
He didn't get the. Did you read the bottle?
yeah, yeah.
Oh, look at that. Nice and tight.
Right
Good
there?
crown health. Nice tight. Yeah.
Okay.
He's moving around a lot with his tongue, but he's got points there. See his points? They're not terrible.
Where's the point?
The little cusps to the up by the
Like,
cheek. There you
right
go.
there.
Right
Okay.
there. Yep.
Okay.
There we go. And his last tooth. There it is. Looks good.
Oh,
The pulp horns look really clean. Infundibulum are full. There's a little infundibular carie on that one. Those little black things right in the middle. No big deal. Not very
Okay.
deep. Excellent. Let's go the other side. And
tell me again what the infundibulum
it's a
is, please.
structure in the middle of the upper teeth.
Okay, and only the upper teeth.
Yeah.
Okay.
And the incisors, but we can't see those now.
Okay.
There you can kind of, let's see where I'm at. There we are. There's a couple of infundibular caries there.
Okay.
They're kind of filled with feed, but not bad.
Right. No
See there,
carrots.
now there's infundibulum filled with cementum, the tan stuff.
Right here?
Yep, that's normal. That's what you want to see, cementum in the infundibulum.
Okay. And that's a natural substance
Yeah,
then,
part of
okay?
the substance of the tooth. And we're falling backwards again. I don't think he does that, because he should be coming forward.
And who discovered that they makes them come forward rather than
Oh,
back,
yeah.
you know?
I don't know, but we sure know that. 'Cause you can't sometimes even budge horses, push them backwards when they're on.
Right.
Good, 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 good. Don't do that. Okay. So that's all good. Yeah, let's go check the bottom row.
All right. Look at his weeniest fanny against the wall.
Come on, buds. Yeah,
There you
go.
go. There you go. And we can push that out too.
Got it? All right. Laptop doesn't go crashing on the
Yes,
ground.
exactly.
Takes the profitability out of the day, doesn't it?
Right. Yes, it does. On a lot of levels.
Oop.
Oh, geez, are you kidding? Oh,
It
there it
just
goes.
times
Yeah.
out. We
Yeah.
just gotta fix the way that times out. It saves the battery,
Right.
or else we have no battery left. See, there's no infundibulum on those teeth. See, they don't have that central structure, and that's the
Oh.
where he's down to the bifurcation of that first molar, which is the split between by the time you get through it.
Yeah.
And again, we see that tan substance called cementum
Okay.
in there. And again, looks pretty good. A little bit mild diastema
Okay,
formation.
yep.
Older horses are just gonna have that. And we'll go all the way to the last tooth.
Remember a while ago I
Right.
called you because she had a question if it was triggered
There,
here.
last tooth.
Wow.
If he has a scar in his left hind.
It's a nice camera unit. I like this one.
But there's not that.
Oh, there's some stuff we can maybe get. in
A
the
little
finger.
bit of,
But I
I
have.
can kind of feel it. I can pull it out. Here.
oh, for
Hey, look at
Pete's
that.
sake.
I pulled it out. Now I'll go back in there. and look at it.
5, 6,
Oh.
7,
His gums look good, huh?
8,
Yeah.
9.
What is it? Stuff I pulled out.
Yeah, yeah, you can see it.
Half my barn is over 20. And half of those guys are over 25. Jack's 28, Missy's 29.
So they look like 23-year-old teeth, huh?
Yeah, but in good shape.
Oh, good.
Faith,
Oh, I can see, yeah.
And just
The
kind of,
human
it just comes right
toothpick.
out. Yeah. It just comes right out. There we go.
Oh, that's really interesting.
Senior
Oh, wow.
center.
So it's just the grass that he just
Yeah,
did right
just
before.
Check this side out. Almost done. We'll give him a little float, and then he'll be in business.
Okay.
He's got pretty decent occlusion. He's not bad at all as far as I go more. So this part of the exam is called the endodontic exam and periodontal. Periodontal refers to the attachment portion of the tooth, the gums right there,
Okay.
and that there's a little diastema of crap sticking out of it
Right.
there. Yeah. So they get little valve diastema in there, and we'll kind of flush that out
Okay.
when we go back in. It's like a lot of these, you can just take your finger. Get a hold of it. But somebody need a little probe. See, now that Torb made him a whole lot more compliant. He's not trying to fight
Yeah,
me.
no.
It did the trick. It's gonna make life easier to clean that out. So we're just gonna turn this off.
Yeah. Then we give you your eye medicine. You want the bucket?
Yeah, that's a good idea.
Just to say
I can flush those out.
good boy.
Yeah, let's flush out really easy. So they're not really a big deal. How's Joel? Is tongue here? Yeah, thank you. And here, no diastema. There we go. Looks good.
Wonderful.
All right, now we'll float
Now
him.
float.
And he'll be just about wrapped up.
Awesome.
Good.
Awesome. Dr. Matt, thank you so much
you.
for this.
One more thing to check. We're
Okay,
gonna
yes.
check how the teeth come together.
Okay,
When we're done, we're gonna quick rinse them out.
all right.
And then we're gonna check to see how the teeth actually come together. This is kind of the coolest thing of the whole deal. Rinse that out.
Is it peppermint flavored?
Wouldn't that be something?
Yeah.
Yeah, that looks like that buck really helped a lot.
Now that one,
That
yeah.
was funny. Okay, so now we're gonna shut this down.
Okay. Good boy.
In the morning, they got, you know, like,
Good
Get his
boy.
legal open halter on.
then go on the morning, then you wait.
Good boy.
Now, if you can get your camera over here, we're gonna look right down the cheek.
Good boy.
We're gonna see how well the teeth come together in the molars. The business end of the horse's chewing is in the molars. A lot of people think, so we put kind of in a neutral position here. A lot of people think they can't chew without their front teeth. They don't even need their front teeth. They don't need incisors to eat, but they do need the molars. And the molars should come together real nice. Let's go a little higher, just so we can see it. We'll be fine, even though it's not exactly a neutral position.
Right, right.
Here you can see how the molars touch. So if you look, when I slide that jaw over,
Yeah.
the incisors should separate and lift up. That meaning he's on his molars. Now if you look right down the cheek there,
Here, you can look
you
right
can
here.
see that. You can see the molars are touching. Can you see that?
Yeah.
That's important that they're touching. Let's go check this side. Because you can do a bunch of work and if the molars aren't touching, you're gonna have hay falling all over the
You
place.
want to come on the side then?
All right, you're up on them over here. I'll get back so you can kind of shine down. Now there's a gap there because that tooth is kind of worn down, nothing, but the next one right behind it is touching. It's probably going to be hard to see on that video.
Right, right.
But you can tell too when it lifts up and you can hear it.
Yeah.
And it's
Yeah.
smooth, right? So he's in good occlusion. We're done. Now we're done.
Now we're done.
You always do that before you're done.
Thank you. That's good to know.
So now I just think my point is, can you see a little difference between this and a person that just goes around and that's
completely.
not trained?
Right, completely, because, yeah.
But it's sometimes it's a hard thing to sell because as a veterinary profession, we didn't do this very well for years because nobody wanted to do it.
Right,
So we kind of lost it. Lay people say, hey, well, we're just going to learn how to do it.
exactly.
And now we want it back again.
And you know what?
Well, guess what?
giving them
The cat's kind of out of the bag. Yeah, right.
Well, they can get blood gel, but they can't give an injection like this. So,
Right.
any last words of wisdom, anything besides make sure you check your horse's teeth, have an equine?
Once a year.
Once a year.
Yeah, doesn't mean you have to do an extensive amount like now. He's
Good to
to
go.
be easy.
Okay.
As he gets older, he'll lose some of those teeth and they may get cracked or loose and they'll
Okay.
come out.
Okay,
Thank you so much.
thank you so much. How do we get a hold of you?
You'll get an invoice that's
All
got
right.
everything on it.
All right, thank you.